Hey, thank you very much for joining us. Good morning. For some of you, it is an early morning. For others, I'm very, very happy you are here. My name is Sivan. I not officially introduced myself yet. I work in Go Cosmetics and Skincare. I'm a medical esthetician, and I'm the one who is answering all your questions on WhatsApp. I just want to let you know that this WhatsApp group, it's such a great opportunity to learn and share ideas as well. I want you to feel very comfortable posting all your questions on WhatsApp because the more question you're going to ask, the more confident you're going to have and more knowledge you're going to get. I don't want you to feel that you're asking silly questions, small questions. Just ask the question. We will give you the support. We'll answer right away. And also, we're going to create a dialogue between ourselves in this closed WhatsApp group. So today, you were waiting very patiently, and I do appreciate that. We're going to do the protocol today regarding the treatments, how to perform the treatments. And let me just share the screen. I will going to post it as well on the WhatsApp group. Just a second. But first, here it is. I hope you can see it. Is it okay? Okay. So let's start. Now, the first page is just introductory about our company. Go Cosmetics and Skincare is a company over 25 years. We specialize in chemical peel treatment for medical cosmetics performance for different severe skin situations and conditions. The chemical peels are designed for all skin type, and some of them designed for, as you know, yellow skin tone, white skin tone, which there is a difference as well. And we're going to scroll down. So what we did here in the protocol, if you can see, we list all our chemical peel products with the list of ingredients. This is something that you can go over yourself and just review it. And I'm scrolling down. This is all our chemical peel treatments. I'm not going to go one by one. You have the list, you have the ingredients. This page and going forward. So when we're performing a chemical peel treatment, there's a few things you need to understand about the treatment as well. First of all, the chemical peel treatment for Go Cosmetics and Skincare are safe to use by professional. Okay, as long as you have an esthetician license, you can perform those chemical peel treatments. Second, there is no need to neutralize the peel. When you're applying the peel, the first two minutes of the treatment, the client will feel some kind of a burn, tingling on the skin. It's normal. After 2 minutes, the peel will stop its activation on the skin. The skin will start coming down. Now, when you're applying the peel, some peel, the skin will turn a bit icy, sometimes it not. It's normal because each skin will react differently because it has to do also with young skin compared to mature skin. After you're applying the chemical peel treatment, there is no need to apply any moisturizer cream. The only thing that you can apply after the peel, it's either the Vera Gold by Go Cosmetic, which is pure aloe vera, or the Omega 369, which is also a pure omega, which I personally love using. It's very oily, so it's really depend what kind of client you're treating. If it's a younger skin, I will do with the Vera Gold. If it's more mature skin, I use the Omega and really massage the skin after the peel to calm it down from any redness. Other alternatives is if you have on hand any antibiotic cream or even Aquaphor where you can buy over the counter, it can also be used. Third, now we are at the fourth point. After 24 hours from the chemical peel treatment, the first 24 hours, the client should not wash their face, no soap, no water. Let the peeling work on the skin. After 24 hours from the treatment, that's when the client can start using those active creams, which will be listed as we go on the protocol. Now, the active creams that we usually mention is the night cream, is the Adi Clear, the Bleach Cream Silver, the Bleach Cream, and Cheval A. Always, what I do with my clients, so they will better understand how much of the cream to apply, I show them physically, because it should be a very small dose. Just to emphasize, I have here the lifting porcelain cream, and I'll just show you the amount. Just a drop, that's all. And the way to apply it, I'm also going to put it on myself. We always start from the cheek, 1, 2, going forward on the chin, ending on the T-zone. That's it. No
Sevan,
need to,
Sevan,
yes.
Can you please stop sharing your screen so that we can see your face very clearly? So
Yes,
everybody,
sure,
yes,
no
yes.
problem.
Yes, do it.
I'm sorry, I'm all new to this. Let me just
No problem.
stop. Hi. Okay.
Yes.
So the lifting porcelain, when I mentioned the active cream, you really put a small dose of the active creams, which is the Bleach Cream Silver, the Adi Clear, the Bleach Cream, and the Cheval A. Those basically the night cream. There's no need to put too much, really a small dose. So as I showed before, I'm just using, this is how much they need to put. That's all. And when you're going to demonstrate to your client how to apply the cream, I'm going to show you now. I always do that so they get a better understanding on the cheek, going down and ending on the T-zone. That's it. No need to rub it too much. Just let it be 30 seconds. It will absorb, and then they move on to the second cream and third cream. Now, the creams, you do not apply it around the eyes up to the cheekbone. Be careful with this area, the edges of the mouth, and not on the neck. Another tip that you can give your client, tell them when you're done with the cream, wash your hands. Sometimes they will start touching the body and it could create a small rash, it's fine, it will go away. But just to be safe, they should wash their hands afterwards. Let me share the screen again with the protocol. Okay, a small dose. The first 2 weeks after the first time that they started with the chemical peel treatment, they stopped using any products over the counter. And the reason is that first, we don't know what ingredients we have in that product, and sometimes it will deactivate the ingredients that we have on those active creams that they're using at night. The first 2 weeks, no moisturizers. They should not use any other creams that they have at home, only the creams that you give them. After 2 weeks of treatment, that's when they can start using some hydration creams, because the first 2 weeks, please mention to your clients, they are going to be red, they're going to peel, they're going to feel dryness, sometimes a little bit of itchiness, but it's all normal. It's part of the process. And let's face it, they're replacing their old skin with new skin. So tell them just be prepared so they won't get overwhelmed and call you, hey, my face is too red, I'm itchy, suddenly more wrinkles appear. No, it's not true. We are, in a way to say it, we're damaging the old skin and creating a new skin. It's totally normal. After 2 weeks, they can start using some hydration. Okay. Now, the chemical peel treatments, we have different kinds. You always start with the main problem of the skin. For example, when a person have acne, they also have post scars from acne, and they usually have also pigmentation resulting from that acne. But first, we want to treat with the acne, dry it out, and any inflammation on the skin. So the way to do it is, if you're gonna get a client who has severe acne condition, you will do first the acne chemical peel treatment, and then you move on to pigmentation and scars. Now, why first pigmentation and not scars? Because scars takes the longest time to heal, up to 6 months, and it's always not a guarantee that all scars will be removed. Pigmentation and acne, right away, the result will show after 2 weeks. The first treatment of the chemical peel, we can do up to 4 applications, but each application, each type of chemical peel should be up to 2 applications. So let's say I have a client, she comes for her first peeling, and she is suffering from pigmentation and scars on her skin. That's her first time. I can do up to 4 applications. So usually I will do the first 2 applications of pigmentation peel. I will do 1 application of scar peel and 1 application of the 20% TCA with 17% Gesner. I will not do 3 applications of pigmentation peel and 1 application of scars, or 3 applications of scars and then 1 application of pigmentation. Each peel up to 2 layers, with the combination up to 4 layers on the first treatment. The second treatment of the chemical peel, you can do up to 2 applications. You can combine, there are peelings that you can combine, there are peelings that you cannot combine, but the second and move on up to 2 applications of the chemical peel. Okay, we got that over. We're going to wait at least. Okay. Between application of the chemical peel treatment, it's always recommended to wait up to 30 seconds to 1 minute, because you want to wait and see the reaction of the skin. Sometimes the iciness that comes from the chemical peel treatment will appear after a few seconds. If the skin turns too icy, that is a sign that you need to stop. That's why wait between application to application up to 30 to 1 minute. Okay, aftercare products, we can, okay. Now, the chemical peel treatment should always be combined with the active cream at night. Why is that? The chemical peel, what we're doing, we're just melting up the upper level of the skin. That's the keratin. It's like your nail. And it opens up the cell. It separates the cell from the epidermis to the dermis in order for the active cream to penetrate inside the dermis and start working on the problem. It promotes stimulation of the blood. It promotes cell division. It promotes the peel of the old skin and renewing. It will lower the activity of the melanin on top of the dermis to brighten pigmentation, and the activity of the sebum. Ever have acne, it will lower that activity, so we will dry up all the sebum and clear up all the acne from inside the skin. The active cream do require refrigerator because they are pharmaceutical, and we need to make sure the ingredients are fresh and to be used. Let's move on. Okay. There are certain peels that cannot be combined with other peels. As I mentioned before, the first treatment and move on, you can combine a few peels together, but there are peels that you cannot combine. One of them is the Blanco peel, the Mila peel, the Blue Gel peel, and Miami peel. And afterwards, sunblock every morning. It's a must for the client. When they're using the active cream at night and they're not going to put the sunblock, they're going to damage more the skin, because most 99% of the skin problems come from the sun, UVA and UVB. Okay. Now, when should we not perform the chemical peel treatment? If you have a client who came to you and have acne problems and they use Accutane in the past, do not touch the client's skin unless 6 months have passed and her system is clear from the Accutane. Any performance that is done before that 6 months of doing the treatment and giving the active creams, they will not benefit from it. It's gonna damage their skin more. So every client who use Accutane, be careful, always ask that question. Customer who's using steroids medication, chemical peel like pigmentation will not help them. Steroid pigmentation promotes more pigmentation on the skin, and any chemical peel and the active cream will not help at all. Any type of burn, if there is a cut, a burn, open wound on the skin, we do not perform any chemical peel treatment until the skin heals completely. Situation of lupus and muscle weakness, shingles on the skin as well, do not perform. Those are different of diseases, skin diseases, where the immune system attacks the body itself. The body itself, do not do any chemical peel treatment. It will not help them. Aspirin sensitivity. Whoever is sensitive to aspirin, do not put the chemical peel treatment on their skin. There's certain ingredients that the body will not handle, and the chemical peel treatment should not be performed. During pregnancy, as you know, the chemical peels and the products go inside the system, the blood system. We should be safe. We should not do it during pregnancy and breastfeeding. Anyway, the body is very hormonal, and the reaction also shows on the skin as well. Skin asthma, dermatitis. Okay, if you have eczema, seborrhea, also dye rash is some kind of dermatitis, which is not relevant to us. There are certain chemical peels that you should not use, but we do have the Mila peel where you can use, and I'll show you as we move on and explain to you. Okay, herpes. A person who suffers from herpes, don't put a chemical peel. If you see on the lip, on the skin, somewhere, you do not perform a chemical peel treatment. You can perform a chemical peel treatment when the herpes has been, or a cold sore have been healed completely. And another thing, if it comes very frequently on the client, it's always recommend to take, there is a peel, a treatment, a 3-day peel treatment that they use. They can take those pills for 3 days before performing any chemical peel treatment on the skin. Okay, let's prepare for the chemical peel treatment. I'm going to do a small recap. I know Shoval did it in a previous Zoom meeting. Before performing any chemical peel, wash the face with the bleach soap or the Blanco soap. Apply the gommage. The gommage is a great product to peel off those dead cells that haven't fallen yet from the skin. And after you apply the gommage and peel it off from the skin, right away you will see how the skin is brightening up. So it's a very good product to use on each treatment that you perform. You will see on the first treatment, the second and the third, each time you apply it and peel off the dead skin, the skin looks much better and lighter. Before performing the first chemical peel treatment, do the thermogel, leave it for 10 minutes. I just want to put a small note that sometimes the thermogel will leave a small pigment of blue because it has a blue pigment in it. Don't worry, it will go right away. You apply it for 10 minutes. You put those plastic wrapper, the food wrapper, put it above it. If you touch the skin, you'll see how the skin is starting to get warm. The pores are getting wider, and that makes it very easy to start doing the extraction. When you're done with the extraction of acne and blackheads, don't need to close those pores. Just clean the skin with 1 quart of alcohol, 1/3 of acetone, and 1/3 of distilled water. Now, the first treatment of chemical peel, as I mentioned, up to 4 layers. As we move on to the next chemical peel and farther on, up to 2 applications. Okay, each treatment peel should be a small dose. This I went over. The omega, we did that. Okay, let's move on to the protocol. Okay, W peel. The W peel is designed for those small wrinkles on the upper lip, a little bit here. The way we should apply the W peel is you take a small dose. Let me show you. Let me just close the screen for a second. Okay, a tiny dose. Tap it on, wipe it, leave it for a few seconds. She's gonna start feeling the burn and the tingling and start massaging it. You can do a little bit here. Don't overdo it, okay? It's a very strong peel and you massage it until it's gonna penetrate inside. I do not neutralize the skin. I like to see the result. Just leave it on. If you decide that the client have very deep wrinkle, another option is just put a bandage above it for a few hours and then she can remove it at home. If the client have very deep wrinkle, another option to make it more stronger, you take the 20% TCA with the 17% Gesner, 1 drop on the facial wipe, just like that. Don't do it, don't overdo it. And above that, the W peel as well. At home, let me move on to the screen again. And don't worry, the protocol will be posted on the WhatsApp group and online, so you have everything. Okay, after the product that you're gonna get, again, 24 hours, as I mentioned before, the client should not wash their face and do nothing. Do not put any creams. The only creams that they're gonna put in the morning is the sunblock. And then they're gonna start using the cream, which is the lip line, 1 application that contains silicone and retin A. Okay, it's very good products right away. Those wrinkles are starting to build up and sometimes even a client, it's also lifting the lip up as well, which is very, very nice. It's a great product. Okay, blue gel peel. The blue gel peel, it's designed for the neck area and you can do it every 3 weeks up to 6 treatments. And the way to apply it is you take either a fan brush or a musk brush and starting applying it from down to up towards the chin. And you leave it for about 2 minutes. But if you see that the client right away have an icy on the neck area, or the skin turns a little bubbly, or it's very burning, right away, you need to wipe it off and neutralize it with cold cloth on the skin until it comes down. Now, I did not mention it in the protocol, but if you feel comfortable with the blue gel peel, it's also good to apply it on this area around the eyes. Let me show you. Right here. Do not apply it on the lower lid or the upper lid, just on the edges of the eyes. Leave it a few seconds, 10, 15 seconds. They're gonna feel the burn, and right away, wipe it off and neutralize it with cold cloth, because the minute you're gonna wipe it off, you're gonna see the icy on the skin. Now, another thing that I personally like to do, if it's a very mature skin and the skin on the neck is very saggy, the elasticity, it's very down, and there's a lot of wrinkles. Another thing that I like to add to the blue gel after I wipe it off and neutralize the skin, I take a little bit of the roan rice peel and I'm starting to massage it upwards in order to penetrate it deeper. Right away, they see that lifting and the results are amazing. The products that they are going to use at home after 24 hours, it's going to be the lifting porcelana, the charisma active, and the blanco as well. Okay, you have it on the list. I put it on the protocol. When to use it in the morning, blanco with, also the collagen elastin for the face and neck. This is the morning night. At the morning time, nighttime is the charisma active, 2-drop, and start massaging it up. I myself also use the lifting porcelana, which is very good on the neck. It's also an option. Okay. We can peel, it's a light peel, it's for rejuvenation, it's for wrinkles. If a client have a nice event that she wants to look very good, you can do the weekend peel, they don't peel too much, and just give them the product of Lior 22, anti-wrinkle, sunblock of course, and at night the Chauvalit. Now, the weekend peel as well, because it's a light peel, I personally don't combine it with any other peels, just do that one, but certainly you can do that. But keep in mind, if the client has an event and she doesn't want to be red and peeling during the event, don't combine it with other peeling, just keep the weekend peel and give her the products. Okay, blanco peel. Blanco peel is appealing for pigmentation for all skin type, white and yellow. It's less, it's not strong as the pigmentation peel, but it's also designed for the underarm for if you have that dark discoloration and the bikini line. You do not combine the blanco peel with any other chemical peels that we have on the list, or what you have in the lips. You don't combine it. It's very strong. They're not going to wash their face for 24 hours. After that, I listed for you for light pigmentation only on the face. You have the morning, the blanco cream and the sunblock, night blanco cream. For medium pigmentation on the face only, again, morning blanco cream, night Adi Clear and Cheval A. If you have for a bad pigmentation, morning blanco cream, night Adi Clear, bleach cream, Cheval A. For underarms and bikini line, you give them the Adi Clear and bleach cream together once a day. Okay, pasta una peel. The pasta una peel is designed for deep wrinkles as well on the décolleté, neck, and face. And you can combine it with the 20% TCA and 17% Gessner for better result. It's all depending how severe the situation is with the pasta una, with the client, how loss of the elasticity and how deep the wrinkle is. Don't feel that each time you're performing a pasta una peel or the W peel to put right away the 20% TCA. Sometimes will be very strong, but usually people who perform that kind of peel, it's for mature skin. If the situation is very severe, don't hesitate, do the 20%, one application, a thin layer, and that's it. Again, 24 hours, they should not wash the area. And I listed the morning treatment, which is the Blanco cream with the anti-silicone, anti-scar silicone, and night Blanco cream with the lifting porcelana. Okay, Mila peel. Mila peel as well should not combine with any other peel. This is designed for, as I mentioned before, if you can remember the dermatitis, this is good for seborrhea, for rosacea, for fungus, for eczema, and for severe acne. If there's acne with a lot of inflammation, you first would like to treat the acne before treating the post-acne scars and the pigmentation. You do one layer of the Mila peel. The Mila peel is strong. The client right away gonna feel that peel and the skin will turn red and probably icy a little bit, not necessarily. As well, I listed the step for you. And at home, for acne treatment on the face, morning, you have the bleach soap, the bleach toner, the Acne Plus anti-scars and open pores, and the sunblock. Acne Plus, it's for inflammation if you have it. It's a very good product. It will kill all the germ and dry the acne. At night, again, the soap, the toner, Cheval A, and anti-acne. Now, this list of products is only for acne treatment. If we are dealing with pigmentation and scars as well, as we move on with the protocol, I'll show you the treatment and the products that you can add on to that list. Okay, acne for back. Again, acne for back with the Mila, because it's a wider area, do 2 applications of the Mila, and they should not wash their back for 24 hours. In the morning, the bleach soap, the bleach toner, and the Ron rice cream. We have the cream and we have the peel that we're selling to you as professional to use in your spa. It's not the same thing. So for home, you sell them the Ron rice cream in the morning. At night, again, the soap, the toner, the Cheval A, and the anti-acne. For rosacea and seborrhea, okay, morning, Nisolite soap or kiwi soap for sensitive skin, the rosacea cream and sunblock is a must. At night, again, Nisolite soap, seborrhea cream, and anti-acne without the sulfur. It's a sensitive skin. You don't want to give it with sulfur. It will be better without. This is rosacea and seborrhea. Okay, for seborrhea on the head treatment. Okay, if the skin, if they are itchy constantly, or you should always open the hair, open, see what's going inside their head, see what's going behind their ears, inside their ears, around their nose. Ask them, are you frequently itching on the head, certain areas? You should also apply the Mila inside the hairline. Just open and apply it behind the ears, inside the ears, all over wherever they have the seborrhea, and give them to use only the Nisolite shampoo. They should stop using any other shampoo that they have at home. If it's a woman and she's using conditioner, usually conditioner, we put it on the edges of the hair, not on the scalpy. That's fine. and you give them the Scalpy. Scalpy is, it comes in a form of a drops. They apply 25 drop on a daily basis, and they should feel comfortable after 2 to 3 days. The itchiness will stop on the hair area and on the face as well. They will feel more comfortable. It's very good products, and our clients love it. It will calm down the seborrhea totally. Now, seborrhea, it's not curable. It's always to maintain, and the goal is to use the right products, and we design at Gold Cosmetics very good treatment for those kind of conditions. Okay, acne peel for face and back. Now, you do have the Mila peel, but if you want to do the acne peel, which is also very good, and the acne is not so inflamed, okay, you can do the acne peel and combine it with other peels as well. Usually we combine it with the pigmentation and scar peel. And the instructions, again, wash the face, clean the face with the alcohol, acetone, and the water. Do up to 2 application of the acne peel. If it's the first time they're coming for a chemical peel treatment, you do up to 4 application where you combine a few peelings together. Not 4 application of acne peel, but 2 application of acne peel, and let's say 2 application of scars peel. They should not wash their face for 24 hours, and I mentioned before, and they're going to start using the products, which is the Acne Plus if they have inflammation, sunblock in the morning, at night, the Cheval A with the anti-acne that contain sulfur. Okay, for the back, the same way as the Mila peel, bone rise, at night, Cheval A and anti-acne. If you decide to combine the acne peel with other chemical peel treatment, because usually on the back, it's not only acne, it also leaves like spots of pigmentation. So it's very nice to combine the two. So you use the acne peel. Okay, scar peels. Scars, as you know, takes time to heal, up to 6 months if it's fresh scars. Fresh scars, it's very easy to work with if you catch it on time. The scars will be eliminated, but old scars will never be eliminated, but will smoothen and blend very nicely with the rest of the skin. You apply up to 2 layers of that scar peel. In the morning, you give them the Lior 22 and anti-scars and open pores. At night, you give the Chauvelite and silicone anti-scars. Now, the scar peel, if you have a client who have very deep wrinkle on her face, you can treat it as scars treatment and not as wrinkle treatment. Okay, very deep, you can do that as well. The scar peels is much stronger and sometimes it's more effective for very deep wrinkles. Let's move on for the pigmentation peel. We have 2 different kind of pigmentation peel, one designed for white skin, one designed for yellow skin. Again, up to 2 application, and the creams that you're gonna give them, again, the morning is the sunblock of course, and the night we have the Clear, bleach cream, and Cheval A. This is the same. So the underline and bikini line as well, you can use the pigmentation peel and give them a Clear and bleach cream. And if you are not certain as far as what kind of pigmentation peel to, what kind of treatment to do on the underarm and bikini line as far as pigmentation, you can, the safe way is to do the Blanco chemical peel treatment as well, but you can use the pigmentation treatment the same way. Okay, We also have hand chemical peel treatment. It's usually for those age spots that you have on the hands and wrinkles. You can apply it. Do not wash the skin for 24 hours. And at home products, they can use the D-Clear with the bleach cream. Sunblock is a must, and silicone anti-scars as well. Oh, okay, let's go. Okay, Miami Gold Peel. The Miami Gold Peel is a new peeling that will come out in about, I think, the next 1 to 2 weeks. It's a very good peel for wrinkles, for scars, and for hyperpigmentation. It's a medium to deep peel. And the way you're gonna do it is you're gonna put 1 to 2 layers of that peeling. Between layers, you're gonna wait 30 seconds to a minute, because the minute the skin starts turning, you wanna see that icy on the skin. So the minute you start seeing that icy, you will know you need to stop. You don't wanna overdo it with the Miami Gold Peel. The client should not wash their face for 24 hours, but should not use any creams until the skin will totally peel off. And the way it's gonna peel, the skin is gonna turn darker and peel off with large patches of skin, okay? Until she peels completely, it takes about 10 days. That's when the client is gonna start using those active creams at night. Another way to use the Mila Gold Peel is for scars. If you have a client who suffers from very deep scarring because of acne, you can do a little bit of microneedling, not too deep with the needles. You don't want to go too deep. And you take a Q-tip with the peel and just on top of the scars, like dots, okay? And that's it. The minute everything will peel off, that's when they're gonna start using those creams. I know it's a little bit maybe hard to understand when I'm talking about it, but we are gonna post a lot of videos and demonstrate it physically on clients so you'll get a better understanding. Ron rice peel is one of my favorite peel. I mostly combine it with most of my treatments. If it's for neutralizing the skin, starting to hydrate the skin, I'll do it before any booster. I combine it with the blue gel chemical peel for the neck. It's very good to dry acne, to build collagen, tighten the elasticity. The skin gets very, very smooth. Now, if you're doing even a basic facial and you're not performing any chemical peel on the treatment, and you have those lot of blackheads on the nose and on the cheek, and after you take them out, you want to close those pores, I take a drop of the Ron rice peel and massage it inside. Right away, you'll see how those pores are starting to shrink down. Okay, hair growth treatment. It's a very good treatment to grow back the hair. Now, it's not going to work on all clients, but mostly does. I usually do 6 treatments. We have very good result with that. And the way to perform it is you take the microneedling machine and you start opening the skin, okay? Rows by rows, okay? I'm sorry if my English is a bit not clear, but you open with the microneedling, you're opening the hair and start doing it. When you're starting, you want to see a little bit of the skin bleeding. And then you take the booster, the B12, and you're starting to massage it inside the scalpy. The client should not wash their hair for 24 hours. After 24 hours, they should use the Nisolite shampoo 3 times a week. The faster hair grows, 25 drops every day on a dry hair, and massage it inside the hair, inside the scalpy. And they should go also, they can find it in any drugstore, biotin 10,000, and take it daily, okay? 6 treatments. After the second and third treatment, the client will start seeing the result where the hair is more thicker, the hair that they lost, they're starting to grow again, and the results are amazing. Now, I did mention that sometimes the treatment will not work is because if comes a guy and says, my father is bald, my grandfather is bald, it's in their genes. They're gonna be bald. But if a client comes and listen, I'm starting to lose hair. A lot of people lost hair during COVID time, during stress. That's when the treatments really work. And you do see that result after the second and third treatment. Do it up to 6 treatments every 3 weeks. Okay, the 2 removal treatment. If you're doing semi-permanent tattoo makeup on the eyebrows or on the lips, you can use that to correct yourself or remove the ink from the eyebrow. The way to do the treatment, you take the machine of the tattoo machine, and with the tattoo removal, you'll see it's a white substance. You apply, the way you apply tattoo, you apply it with that tattoo removal until the skin opens up. When you finish with that, you take again the tattoo removal, you apply a layer, take those plastic food wrapper, put it on the area, leave it for about 10 minutes, and right away you're gonna see how that ink is floating out from the skin. And you can repeat that treatment every 28 days. You know, there's a cycle for the healing process. After that 28 days, 21 days, you can do that treatment again. Lifting porcelain peel. Okay, this is, I personally love this peel because the result shows right away from the first treatment. We are gonna have it soon. The lifting porcelain peel is for heavy lifting. It comes in 2 containers. It comes with the gel and it comes with the peel, and then comes with the mask. The first thing that you're gonna do, you wash the face, you do the instruction, keep the skin clear, clean totally. You take the first jar, which is the peel, and you're starting to massage it from the décolleté to the neck and around the face until it's totally gonna penetrate inside. After that, you take the second container, is the gel that contains inside small gold pearls, and you massage the skin until those gold pearls will melt and absorb inside the skin. After you massage it, you take those brown bandage, you wrap it around the face, and leave it for about 45 minutes on the skin. Let the client lay there, read a book, whatever, 45 minutes. When you take it off, right away, you'll see how that skin is lifted up. You can repeat that treatment a few times every, I would say, a month to 5 weeks, but don't try to penetrate after that treatment. Do not try to penetrate any other creams or boosters, anything, because what that peel does is it shrinks all the blood vessels in the dermis. And when it shrinks it up, the skin will not be able to absorb any creams, boosters, nothing for the first 24 hours. After 24 hours, in order to maintain the effect of that peel, you give them at home in the morning the Blanto cream with the hyaluronic acid. At night, the lifting porcelain cream with the Charisma Active. This is a great treatment if a client, first of all, to build up collagen, tighten the elasticity, work on those wrinkles, or if she has a very, she has an event, she wants to look pretty, radiance, the glowing, lift it up. This is a great treatment. I personally love it very much. I do it very frequently in our location on Hallandale Beach, and it's recommended. Okay, so we're done with the chemical peel treatments. This is the list that we have. Let's do a recap, okay? During the peel treatment, this is something that a few of you posted on WhatsApp group, either on our formal group or texted us personally, where the client calls you, oh, I'm red, I'm peeling, I feel dry, I see more wrinkles. Not at all. This is the process, and it's very important to emphasize to the client before they're starting the treatment, because the first 2 weeks, the client will be red, will peel, will feel dry. Sometimes it will itch a bit. It's all normal. It's part of the process. And after 2 weeks, of course, they're coming back to your location where you're gonna nurture the skin, calm down the skin, and then decide we're gonna do another chemical peel treatment or not. But this whole process of the peeling and the redness and the dryness, it's the first 2 weeks where the skin is renewing itself. Remember, you're giving them active cream. You did a peeling treatment. It's normal. Now, I get a lot of reaction. Oh, I see more wrinkles. No, it's not wrinkles. The skin is renewing. It's building collagen. There's a process that the skin is going through. After the 2 weeks, they looked completely different. Okay, the first, as I mentioned before, I'm gonna go back to the chemical peel treatment. When you're applying it, they're gonna feel a burn for that first 2 minutes. After that, the peel stop working, and you just leave it on for 24 hours. When they're gonna start using the cream, they're gonna start peeling after 48 to 72 hours. Now, the way the peel is gonna look, I'm not talking about the Miami Gold peel. I'm talking about the other peels. It looks like a kind of a scalpy kind of a look. And it's not large patches of peel on the skin, okay? So let them be aware. There are certain clients that even sometimes will not peel. Each person, the severeness of the peel and the redness will be different. When a client, usually the more mature the skin is, sometimes they will not peel the way younger skin will peel. But as long as you see the redness on the skin, you know that something is working. So it's fine and it's normal. So it's very important to emphasize it to the client so they know what they are up to, so they won't be surprised. And if they are surprised, you mentioned it. So, it's nothing new to them. Cause any cut or scarring. Okay. When they're peeling, don't tell the client not to help with the peel. Okay, do not touch the skin, because if they're going to start playing with their skin and helping with the peel, they're going to create a cut create a scar, and it's not pleasant. If the first 2 weeks they feel uncomfortable, the only thing that they can apply just to smooth the skin up and calm it down, it either Aquaphor or Vaseline, or you can give them the gold, Verigold, or the Omega, which I personally like it very much, just to calm down the skin during the day. A very important note, if they're gonna apply, let's say, Vaseline or Aquaphor or the Omega, do not apply it before applying the active cream, because Vaseline floats on the skin. It's going to prevent those cream from penetrating inside the skin. So before they apply those active cream, they need to wash their skin very good, apply the cream. Afterwards, after the cream's absorbed totally, they want to put a little bit Vaseline, that's fine. But mention it to the clients as well. The skin looks great, pigmentation. Okay, now they are gonna start seeing the result after 2 weeks. With the acne peel, I wanted to mention, because I forgot before, at the beginning, more acne may come out, which is normal because you're cleaning the acne from inside the skin. But they're gonna see the acne comes out, but gonna dry very fast as well. So they are gonna see the results. So if you have a client with severe acne, also mention that as well. At the beginning, more acne may come out. That's why you always invite them back to your clinic to clean them up and do another chemical peel treatment. When you start seeing the result, the acne is clear, the pigmentation is clear, the seborrhea also, it's clear. That's when you're gonna start hydrating the skin, and you're gonna start using boosters like vitamin C, hyaluronic acid, collagen. Also, I use sometimes even B12, although we also use it on the head. It's good to nourish the skin and bring that glow back and hydration, because it's not always just applying a chemical peel, a chemical peel, a chemical peel. No, we also need to hydrate the skin and lift it back again after we see that result. And that's when you're going to start using those boosters. This is a few pictures, the before and after. You see alopecia. This is hair loss that caused from stress. Men and women as one. He lost the hair. That's when the treatment for hair growth do work. If he lost the hair because his father is bald, his grandfather is bald, it's in his gene, it's not going to work. But if it's something, a condition, a psychological condition that causes from stress, or as I mentioned before, from COVID or some kind of medicine, you can use that hair growth treatment. They will see the result after the second and third treatment, but be consistent every 3 weeks. Second picture, we have the wrinkles as well. This is before and after. We have the acne and scar treatment. As I mentioned before, this is very inflamed. So if you have a client who comes in this kind of situation, first and all, treat the acne. And you treat it either with the acne peel or the Mila peel. The Mila peel is very good for inflammation. I personally will start with the Mila peel. As she's going to start seeing the result, that's when I'm going to start combining the acne peel with the pigmentation peel and the scar peels as well. Here is another situation of hair growth. As you can see here, she sees the result. This is another situation of hair growth. Melasma. Okay, the melasma, this is yellow skin tone. So it's a pigmentation peel for yellow tone. The first treatment, you should do 2 applications and combine it with the 20% TCA. Now, because if they're coming for a first treatment, you want to take advantage of it and treat the client. Do 2 applications of the pigmentation peel for yellow skin tone, and you can add a wrinkle peel as well, just to build up collagen. It's a nice suggester for your clients as well. Here is the seborrhea and rosacea combination of 2. It's very important to know how to diagnose this situation, because this is not an acne situation. This inflammation causes from the rosacea and seborrhea combined together. And the way to treat it is the Mila peel. Give them the anti-rosacea, anti-seborrhea, and the anti-acne without sulfur. After 2 weeks, they're gonna start seeing a result. Here is another situation of fungus. This client went from doctor to doctor thinking he has a pigmentation situation. No, this is not pigmentation. This is a fungus situation. The only thing, Mila peel, and you give them the anti-acne cream with the anti-acne liquid. After 2 weeks, they're starting to see the result. That's it. That's all for today. I am gonna post this protocol on the WhatsApp group. If you have any question, let me just see. Let me see what's going on with the question.
Yes, there are some questions.
Okay, question. If I rub the products on the skin with melasma, will this activate the melasma more? Thanks. Okay. No, the opposite. It's not going to activate the melasma more. It's gonna start
Excuse me, Sivan, please.
yes.
Please. Yes, stop sharing. Yes, so that people can
stop
see.
sharing. Okay. How do I stop sharing? I'm sorry, guys. Here. Found that bottom, just a second. I'm stopped sharing. Okay, here I am.
Yes.
Okay. 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 So with the melasma, no, it's not. It's the opposite. It's reducing that active melanin in the dermis. So it's gonna break that melasma and starting to brighten it, and starting to lower that reproduction of the melanin in the dermis as well. But if you have, when you're putting the cream for pigmentation, tell the client not to emphasize so much on this area, okay? Emphasize on the cheek and whatever is left over on this area in the forehead. Because sometimes, especially if they're using the Cheval A, it may cause a little bit of reaction, but definitely it's not going to cause more melasma. The purpose is to brighten the melasma. Otherwise, we are not here. You all can, let me see another question. We're going to save this class as well. And of course, if we need to do another class for this protocol, we are going to do it as again and again. We're going to post the protocol, as I mentioned, online and on the WhatsApp group. Can we do a peeling after hydrofacial? What peel we should use? Okay. I will not do a peeling after hydrofacial because you're losing the effect of the hydrofacial. The purpose of the hydrofacial is to hydrate the skin and nourish the skin. And when you're doing a chemical peel, then the skin will be peeling and dry and redness, and there's no need to start with a hydrofacial, because during the hydrofacial you're also observing boosters. We don't need those boosters. We need a totally clear skin from any substance. So combining the two, don't waste your time, don't do it. It's not recommended. If you have any other questions, please post it on the WhatsApp group. We are here to answer all your concerns. Please feel to post any question you have. If it's a small question, if you feel it's a silly question, there's nonsense. There's no such thing. The more question you're going to have, the more comfortable you're going to feel, the answer you're going to receive. And I'm pretty sure your questions is the question for other people on that WhatsApp group. I really appreciate you taking your time on this Sunday morning, watching participating in this Zoom meeting and participating with all those WhatsApp. I'm here to answer all your questions. We are going to leave it on the website recorded. And I'm gonna soon also gonna put the protocol for you to read at home, read it carefully. There's a lot of information there. And if you have more questions, I am here for you. Have a wonderful Sunday and thank you very much.